This is an educational video produced by residents and faculty members from the departments of Pediatric Dentistry and Preventive and Community Dentistry at the University of Iowa's College of Dentistry. The title of this video is Caries Risk Assessment for the Young Child. Caries Risk Assessment, as described by the American Academy of Pediatric Dentistry, is used to assess the level of risk of caries in infants, children, and adolescents based on a set of clinical, environmental, and general health factors. The purpose of caries risk assessment is to identify children who are at higher risk for developing dental caries, to help implement preventive measures as early as possible, to help determine the appropriate interval between recall dental appointments, and to prevent the onset of early childhood caries. A caries risk assessment tool assists health professionals in collecting and documenting specific information concerning an individual's risk for developing dental caries. Examples of the caries risk assessment tool developed by the American Academy of Pediatric Dentistry and other slightly modified versions can be found on our department website, which will be shared at the end of this video. This particular version of the caries risk assessment tool is currently being utilized at the University of Iowa's Pediatric Dentistry Clinic. It consists of three main categories: history, clinical evaluation, and supplemental assessment. After collecting this information, a clinician can classify their patient as either high or low risk for developing dental caries. For the sake of this video, we will be focusing on caries risk assessment for the very young child and the risk factors for developing early childhood caries. Children from families with low income and low dental literacy backgrounds and minority groups with different cultural and ethnic backgrounds are at higher risk for developing early childhood caries. Children chronically ill and with special health care needs, and those with saliva-reducing factors, possibly side effects of medications and medical treatments, are at higher risk for developing early childhood caries. Children who consume cariogenic snacks between meals more than twice a day, and those that consume cariogenic beverages more than twice a day, are also at greater risk. There is also great concern with exposure to nighttime sugary liquids and prolonged on-demand nighttime breastfeeding. Other risk factors for early childhood caries include early contamination with S. mutans bacteria, poor and/or inconsistent daily oral hygiene habits, and inadequate fluoride exposure, such as no regular use of fluoridated toothpaste and/or fluoridated drinking water. Lack of good prenatal care and inappropriate habits during pregnancy may lead to low birth weight and prematurity, which may cause enamel defects such as enamel hypoplasia, which is also a risk factor for early childhood caries. It's important to know what clinical findings are predictive of high caries risk for the young child. Previous dental caries experience is one of the best predictors of future caries. For children under the age of 5, a history of decay should automatically classify a child as high risk. Visible dental plaque is one of the best predictors of future caries risk in young children. Screening for visible plaque is relatively easy and inexpensive. By lifting the lip, it will help you better visualize the area right along the gum line where plaque tends to form. A clinician should look for white spot lesions which follow the contour of the gum line and are often accompanied by plaque and bleeding gums. Enamel defects and stained pits and fissures in the primary teeth are also clinical risk factors. Screening for strep mutans is more costly than other risk assessment techniques and is not extensively used in private practices, but it can provide a means for documenting success of interventions. By evaluating these clinical findings, experienced practitioners are reasonably able to predict caries risk with high levels of accuracy. Efforts to prevent the caries occurrence include parental education, diet modification, maintenance of proper oral hygiene, appropriate use of fluoridated toothpaste and access to fluoridated water, professionally applied fluoride varnish, and sealants where appropriate. We hope you have found this educational video helpful. You may obtain additional information on our department website listed here. There you will find caries risk assessment tools, various fact sheets on pediatric oral health topics, and additional educational videos and resources. Support for this project was provided by a grant from the Delta Dental of Iowa Public Benefit Fund. On behalf of the residents and faculty from the Departments of Pediatric Dentistry and Preventive and Community Dentistry at the University of Iowa's College of Dentistry, we wish to thank you for your attention.